This is Dr. Sharma, maxillofacial prosthodontist, implantologist from Colonel's Dental Spa, Bangalore, India. A tooth after root canal treatment will require a crown to restore the function of the tooth, mastication, as well as aesthetics and speech also. But to fit a crown on the tooth, sufficient amount of tooth structure should be present so that the crown gets enough grip for retention. Sometimes because of the tooth decay or a fracture of a tooth, the tooth structure may not be sufficient for the crown to hold. In such cases, after root canal treatment, the tooth structure can be built up using a post and core. Now, a post is a restoration that is inserted into the root canal after root canal treatment for support, and then the tooth portion is built up around the remaining tooth structure and the post, which is actually called the core build-up. Now, the decision whether to do a post and core or to remove the tooth, depends upon the dentist and his and certain scientific guidelines. It is the decision taken by the dentist. It also depends upon how much load the tooth can bear. Now, posts are of several types, primarily prefabricated and custom made. Resin fiber reinforced posts are generally used for better strength, aesthetics, as well as durability. Once the core buildup has been done, a good ceramic crown is placed to restore the function of the tooth. At Colonel's Dental Spa, we specialize in all types of post and core buildup and always give the right opinion and decision to the patient for a better longevity of the work that we do. This is Dr. Sharma from Colonel's Dental Spa, Bangalore, India. Planning a dental prosthesis requires the incorporation of certain basic engineering principles. Therefore, a wrong planning can lead to failures or complications. There are several variables in planning an implant-supported denture, which may include the age of the patient, the physical build of the patient, male or female, the quality of bone that is available for the placement of the implants, and much more. We in our clinic believe in a little over-engineering in our planning so that to avoid any complications subsequently. There may be several complications in implant-supported dentures. The denture itself might break, the implants might fail, the attachment parts which have been fitted, they might wear out. At Colonel's Dental Spa, we have the knowledge, the skill, and the experience to place dental-supported implants so that the complications subsequently are minimum and our patients enjoy trouble-free dental supported implants for a very, very long time. This is Dr. Sharma, maxillofacial prosthodontist, implantologist from Colonel's Dental Spa, Bangalore, India. The most common restoration for protection of the teeth, especially the front teeth, where we can also improve aesthetics, is providing a full coverage crown. Now, laminates are a good alternative in certain cases where aesthetics has to be improved, especially in the front teeth. Laminates are particularly used for improving aesthetics for permanently discolored teeth, where cases where there is fluorosis or sometimes tetracycline staining, and also some kinds of decays where there are fillings, and also for closing small gaps between the front two teeth. Laminates are made of several materials, but the ones made in all ceramic are most popular and they are long lasting. The advantage of making a laminate are that they require minimum preparation or grinding of the tooth surface. The most of the time, root canals is not required, and fabrication of a laminate requires very special skills. Tooth preparation is a very technique sensitive procedure. Shade matching with the adjacent tooth is a challenge, And it is a skill which has to be mastered. At Colonel's Dental Spa, we have the knowledge, we have the skill, we have the experience of hundreds of successful laminate cases, providing excellent color match, good aesthetics, and restoring a perfect smile. This is Dr. Sharma, maxillofacial prosthodontist, implantologist, Colonel's Dental Spa, Bangalore, India. Teeth play a very important role not only for biting and chewing the food but also have a function towards giving support to the lips and the cheeks and giving shape to the face. Teeth also play a very important role in correct pronunciation of speech and certain words. Missing teeth can hamper one or all of the above functions. Therefore, replacement of missing teeth is important. In case if a person has missing teeth on one side, he can't keep chewing food from the other side for life. This will have adverse effects on the temporomandibular joints. Replacement of missing teeth can be done by either removable partial dentures, hardly done these days, or removable complete dentures when all the teeth are missing. Fixed replacement of missing teeth can be done by bridges or implants. A bridge replaces the missing teeth by taking support from the adjacent existing teeth. But adjacent teeth, which are the natural teeth, should be in good health to take additional load for the missing tooth. Therefore, to replace one missing tooth for a bridge, we need to grind one tooth on either sides of the missing tooth to fill the gap, which means to replace one natural tooth, we have to actually grind two natural teeth. A better treatment option is dental implants. An implant replaces the missing tooth in a permanent way, so that for one missing tooth we need to put a single implant without touching the adjacent teeth at all. An implant is made up of titanium, which is placed under the gums for 10 to 12 weeks. Bone grows on the titanium surface over a period of time so strong that the implant becomes part of the body, part of the bone, and then a tooth can be fixed on top of the implant. So for replacing one tooth, we require one implant. It also means that for replacing two adjacent teeth, we require two implants. But in case there are three teeth adjacent which are missing, we place only two implants at the extreme ends and we bridge the gap. This is also called an implant retain bridge. Similarly, in patients who do not have any teeth in the mouth, we can place 12 to 16 implants in the upper and the lower arches in the predetermined areas or spaces, and then replace all the upper and the lower teeth with bridges which are fixed. Sometimes when bone is not available, for example in completely edentulous patients, we can do something which is called all-on 6 system, where only 4 to 6 implants are placed and then the whole arch of the artificial teeth can be fabricated on top of them. At Colonel's Dental Spa, we specialize in all the dental implant systems. We offer various treatment options, various treatment modalities, which is best suited for patients to restore form and function. We have placed successful implants in patients with very strict treatment protocols.